There.
Oh. Oh yeah,
that
baby.
was great. Big breath in and close.
Oh my God, I definitely heard cracks in my face.
That one cracked. So I have a new client here today I'm excited to work with. His name is Douglas. He's got a good first name, as you could probably tell. Tell us a little bit about why you're here today.
Yeah, so I'm middle-aged now. I've had a very active life, firefighter, then I was a photographer for years, and now I have a more mundane job, but I also work on motorcycles and very physically active. Mm-hmm. And so I find I'm always in pain. And one way or another, I'm in pain. And you just kind of get used to it over the years. Mm-hmm. But I wanted to address the minor herniation and general pain that I have in my lower back, mm-hmm. possibly my mobility. And then also, I have an acute pain here on my, what was it, my ladder?
That would be your trap.
My trap.
Yeah.
I was getting that wrong, ladder trap.
Yeah.
Right here, because I always, when I ride my motorcycles or throughout my day at my desk, I'm always kind of like stretching, and I'm always like want to stretch it out. I had a massage therapist really work on it. I almost screamed in pain. It was like, he was really
Did it help though?
It helped a little bit, yeah,
okay.
For sure. But over time, you know, it kind of comes back, mm-hmm. Particularly on that side. For a while, I couldn't turn left or right, but now it's better. But again, I just kind of got used to pain. But it's come to a point where I wanted to address my overall wellness. And mm-hmm. so I learned about, your practice. You're not far from where I live. So here we are.
All right, good. So if someone has a fresh injury, that's called acute injury, ACUTE, and that's something extremely recent. And then there's chronic, and there's a new phase that I've heard before, which makes sense, which is called permanent. It's hard to believe in permanent because I always think there's room, as long as we're alive, there's room to make a change. But if someone lets chronic go for too long, it almost becomes a permanent type of pain. So I do encourage someone to never give up, and if you can, work on the chronic. But if you had someone with chronic pain, the two areas to try to make advancements with would be one, make the area stronger, and the other is to make it more mobile or flexible. And typically people need both, although once in a while I'll see someone that has plenty of strength. You'll see like a guy with gigantic body, building body, and that person's probably strong enough for this lifetime. That person really needs mobility to make a change in chronic pain. But most of us need both. And we need to strengthen that area and also give it more mobility. I like to think that the chiropractic accelerates that timeline because we can get in and remove some of the impedance or obstruction that is keeping that area from having the space to heal at the next level. So that's what I try to add. But people need to look at those two things and say, how can I make it more flexible? How can I make it stronger? And usually that's part of the journey. If you're ever gonna have a chance to turn back the clock and make that area fresh again, those would be two components you have to look at. But let's get cracking. All right, this is gonna go around your ankle and begin to stretch you a little bit, okay?
Okay.
You'll feel it in a second. And then I'm gonna have you reach out to these handles. Okay. And this one will be a good length for you. And basically this flexes and distracts and just gives a little separation in here. And I can add to it by stretching the table a little bit more.
This is a medieval torture device.
This is exactly it. You're on the rack. And kind of we're draw and quartering you, or at least the drawing part. Oh. Would you feel that already pop a little bit?
Already.
Yeah. So I don't know if people know or they don't know, or a lot of people know because I talk about it sometimes, but I've been a chiropractor since 1998. So how many years is that? 25 years. But before that I was a massage therapist for 8 years. So I do like massage. I've always loved massage. And I went to massage school and got licensed in massage. But so, not all chiropractors like to do muscle stuff, but I really love it. So I do like digging in, and I do like working on some of the deep tissue stuff. And they didn't teach that much massage at school because they really wanted you to just specialize in chiropractic adjustments. But I've always held on to it, so I like tying that in. Like right now I'm up into your trap.
Oh yeah.
And I'm starting to go strong into this muscle. And if I come to the left a little bit, I'm on the levator scapula, which elevates the scapula or the shoulder blade. And then you just felt that little crunchy spot. And now I'm at the top of the trap, kind of the upper branches. And I'm going to start again mid-thoracic and come up again. So I'm on his left side. And it should hurt but feel good at the same time. Like it should be like out, but good. Does it feel kind of good in a way that it's therapeutic, or is it too much?
No, it's not too much. It's definitely hurts, but it's so tight. I mean, I have a thankfully well-developed back, but the muscles are just so pissed off on that side. Not even as bad on the right side.
So now we're on the right, and this is semi-normal on this side, right? I'm going to stop for a second. I want you to sit up, just because I have a feeling they're not tracking the same on both sides. So I'm going to start on the good side, which is the right. And I'm going to bring the arm up, and that comes to 180. That's really nice. Keep your head up if you don't mind. And then we're going to come this way also, and
hurts a little bit to do that, but
tight that way.
Yeah.
And then let's try this side next.
Okay.
A little stiffer on that side, isn't it?
Yeah, I felt it pull on the outside shoulder.
Here, you do it. So this time, when the doctor moves the arm, or the practitioner, it's called passive range of motion, because you're being passive and letting me do the lift.
Sure.
To some extent.
Yeah.
And then if you're doing it yourself, it's called active range of motion. So I want you to do side, which is lateral. Thumb is sort of towards the top, towards the ceiling, and do an active range of motion. And then you stop when you feel kind of, it's like, Yeah, and now notice you pulled your head over, so right about there.
Yeah.
Okay, good. And then do this side and teach me what you're feeling. So stop when you feel it get bogged down.
That's pretty.
Yeah.
Yeah. I feel. Although I just did shoulder exercise yesterday at the gym, but that being said, I feel a pull right here.
Yeah.
Like a block. And
it's kind of locked or blocked. Right?
Yes, and then it's definitely pulling.
Through
right
the lat,
where
the lat ties under the shoulder. So let's do a little bit of a release on that, and then we'll keep working on this. But this could be a part of why that shoulder doesn't feel as good on the left as it does on the right. And this is a percussive instrument that pushes this. In this case, I'm doing his clavicle, his collarbone, and then I'm going to push his scapula over. And then I'm going to come to the edge of the acromion bone and get on the head of the humerus, which is the ball of the upper arm bone, and just creating a little space there. And then I'm going to pull down a little bit more on the humerus on this end. The fluidity already is starting to open. Do you see? Isn't that cool? So now I'm going to hit this trigger point under here, and going to dig into here for a minute. Now you might notice this is tender.
Oh yeah.
Because this is one of the spots that's restricting your arm from really rolling up all the way smoothly. And I'm on a nasty spot because that's what I want to get into, is this spot right here.
Yeah, it feels like the skin's ripping off my body.
Oh, sorry.
No, I didn't know if that was a muscle. I don't know what's going on back there. There's just a lot of activity. That could be the muscle for all I know.
It is the muscle.
Yeah.
Because the skin is still intact.
No, I'm sure you're not ripping my skin up. It just feels that way.
It feels that way.
Yeah, it feels that way.
So now I'm going to have you lie on your side.
Okay.
Oh, I guess you are missing some skin. No, I'm joking. So now I'm going to dig this right in here.
Okay.
And that should be pretty intense. And right in there.
Oh yeah, I feel that. It's a good stretch though.
Yeah. Good. Now lie on your back. Now I'm going to crush your arm over. This one stays on your belly.
Okay.
My hand's going to go into your armpit a little bit.
Okie dokie.
I'm going to reach under, set that.
Nice.
Now come back to your original spot on the chair.
Okay.
And try your the left arm again, and it should be much freer.
Oh yeah. Not a fake. Not faking it for sure. It definitely, before it was like pulling and locking here, and felt I had like bricks in my shoulder.
Now you also have this.
Yeah, I feel that.
Which is the upper cervical. So I'm going to have you sit here next, and I'm going to do a little bit of a lift on your upper left.
Okay.
Drop your head this way. There.
Oh. Yeah.
Now try your left shoulder.
Okay. Nice.
A little smoother, right?
Yeah.
Good. So now lie on your back.
Okay.
There we go. Now we're going to go into the shoulder blade area together.
Okay.
Instead of just one side, we're going to do both.
Yeah, I got it. Felt that.
That was a big one.
Mm-hmm. Yeah.
Lie on your side facing this way towards me.
Okay.
Now, you did see a couple of the videos with the balloons.
Yeah.
And that's something you thought you would
Yeah, I
try?
thought it was interesting because I had I actually have no sense of smell. I lost it in my teens. And I later on in life was like, maybe technology is new. And so I had a scope done by an ENT doctor.
Yeah.
And he's like, your nerves are fried. It was just, I had a bunch of sinus infections as a kid, but your nasal passages are super small. So like I get stuffy without anything. I get a little swollen from hay fever or something and it's blocked. So
And
I was like,
you never got your sense of smell back?
never got it back, no.
Okay. I don't know if this would work for you, but we have had a few people regain their sense of smell.
Oh, interesting.
But not enough that I would brag about it.
No,
You know?
hey, anything
Yeah.
will help.
Big breath in and blow it out.
Oh yeah,
That
baby.
was great, wasn't it?
Yeah.
So that's your lower back.
All right.
And that was a complete,
Yeah.
big breath in and blow it out. Perfect. So I got both sides really well.
You sure did.
Lie on your back.
Okay.
These are fine. Ooh, that one was out.
Nice.
So I'm going to do a little bit of a Y strap on you.
Okay.
And I say a little bit because I don't want to, I already got your neck really well, so I don't want to overdo it.
Okay.
So what this feels like is I first stretch and then I pull. Big breath in and blow it out.
Oh yeah.
And you
Felt
feel
that.
that last little one go.
Uh-huh. Yeah, felt awesome.
Good.
Felt that from mid-back all the way to the top of my head.
Come stand and see how you feel while I set up the CFR.
Okay.
How do you feel? Move around, move your neck, move your shoulders.
Mobility feels nice, particularly on this left side. Is that gonna benefit the tension that I'm feeling here on my,
Yes.
like on my trap, lap trap?
I think part of the trap is your body's using it to stabilize, but you lost some of your range of motion because your collarbone was jammed and your lat was going into chronic spasm. A really good stretch for you could be something like this, where you put your hand up, you could put it up on a doorway even, and then push away. So you're creating an arch on the left,
Understood.
but using this for extra leverage.
Right.
All right, so we're gonna do the CFR next. You're gonna lie on your back. This is floppy.
Thank you.
Gives
Oh my
you
God.
something to hold on to. Floppy has been in about 600 videos.
Oh,
by
amazing.
now.
Okay.
Floppy's kind of a fan favorite, I think. Once I place the balloon, I'll say, whenever you're ready, take a breath and hold.
Understood.
And it'll look like this. Try it.
Okay.
That's it. As soon as you close your lips, it's over in half a second.
Okay.
And I'm gonna do the right side first. And big breath in, and close your lips. Did you hear any pops or
No
something?
pops, but I definitely a lot more opening. I felt that. I definitely felt it. No pops, but
Okay.
expansion for sure.
So let's do the other side.
Okay.
Big breath in and close.
Oh my God! I
Now
definitely
that-
heard cracks in my face.
That one cracked.
Holy cow! I'm trying not to swear, but yeah, that was a wild feeling
Point to where you felt the cracks.
right here.
If you can do one more, I would do one more on the right because there's another concha that we can do that I
Okay.
think would be, after experiencing working with you, I think that's the area that's most involved.
Okay.
Which is the upper concha on the right.
That was wild, man.
So here we go. Big breath in and close.
Oh,
So that's what I mean.
holy, yeah,
And here's some tissues.
that was a wild feeling.
Sit up for a minute and tell us what you noticed and where you noticed it. We'll start about the belt.
Oh wow. Yeah, felt it. I assume it's just like right near the sinuses are. It was a literal cracking noise and feeling if you imagine cracking your back, imagine it in your face. Airway opening definitely improved. It's a lot to take in. I've had a lot of like good stuff you've done today, but it's definitely feels a little more open. I'm curious to see how we evolve it. I'm very curious. It's awesome.
And if it seems like it's something you want to pursue, you would come in a week and do one more.
Okay.
And you know, take it 1 week at a time.
Cool.
All right. Thank you so much.
Thank you,
All right.
Doc.
Appreciate it.
Yeah, it feels like the skin's ripping off my body.
Oh, sorry.
No, I didn't know if that was a muscle. I don't know what's going on back there.
Oh, I guess you are missing some skin. No, I'm joking.